Now, I suspect all of you are aware that our Phase 2 proclamation expires tomorrow. It has to be replaced by a new proclamation, and we're employing the exact same gating criteria that we've done up to now to determine the next steps. And as you will recall, those are COVID-like illnesses being reported to our emergency departments. It's testing and cases, I should say, based on both the raw number of cases and also test positivity, the number of positive tests that are yielded by the tests administered. And then we look at hospitalizations to make sure that we're nowhere near crisis care and have adequate capacity and those sorts of things. You also have to look at your ability to test to make sure that you know exactly what's going on, well, as best you can with a public health emergency. And we look at that for 2 weeks, the last 14 days worth of data that you have. What I'm prepared to say today is that data is positive enough that we will be going into Phase 3 tomorrow, and we will get deep into the weeds with you all about Phase 3, the gating criteria, what the data looks like, also what Phase 3 will look like, but we're going to do that tomorrow, and then I will be traveling later today to go to Vernon, Allen, and Cameron parishes, and then we'll come back and we'll work into the night preparing the new proclamation. But I did want to share that with you all right now. I will tell you, for reasons that I'll get more into tomorrow, this was probably the hardest decision that I've made thus far. Not based on the data itself, but based on all of the activities that have been going on in the state of Louisiana recently that could influence where we are 2 or 3 weeks from now that isn't reflected in the data upon which I made my decision.